Hello, friends. Welcome to the Research Evangelist podcast educational series. This podcast series, in partnership with LUNGevity Foundation, is supported by an unrestricted educational grant from Pfizer Oncology. And this is a three-part series dedicated to shared, or I like to say, informed decision-making in non-small cell lung cancer. And I'm your host, Dave Bjork, a lung cancer survivor and patient advocate. And today we're continuing our series on shared, informed decision-making in non-small cell lung cancer. And in this episode, we're talking about something that can dramatically shape the patient experience, but is often treated like a secondary conversation, and that is side effects. And for many patients, treatment decisions are not only about effectiveness, they're also about daily life. And so today we're exploring how side effects influence treatment decisions and why quality of life matters so much in shared decision-making, and how patients and clinicians can have honest conversations about treatment trade-offs. And joining me today, I'm very excited, a pharmacist from Indiana University, Mark Botros, and a patient from Colorado living with non-small cell lung cancer, Nancee Prosati, who has firsthand experience navigating treatment-related side effects. So thank you very much, both of you, for being here today.
Thank you for having us, Dave.
Thanks for having us, Dave.
Awesome. Well, I'd like to start by talking about why side effects are such an important part of shared decision-making. And Mark, maybe I'll start with you. And can you tell us, like, how should side effects be part of treatment conversations from the very beginning?
Yeah, that's a great question. And it's something that we look at differently in oncology, is that side effects cannot be sort of like a disclaimer at the end of the conversation. They are part of the actual treatment decision. So all these side effects have to be weighed with equally to the effectiveness of the treatment. So we try to make sure that patients not only understand what the drug will, how does it work, or what it does, towards tumor and the cancer, but how it may affect your day-to-day life. So can patients still eat? Can they still work normally? Can they travel? Can they stay independent? Those things matter very much to everyone, to patients starting treatment. I think patients really appreciate honesty early on and the details in terms of when they're starting treatment. Most people don't expect treatments to be easy, but they do want realistic expectations. So when we involve side effects in the conversation from the very beginning, patients and their caregivers are more prepared. They're more engaged. They're ultimately more confident in the decisions that they make. And this really is, in my opinion, the one of the core building stones of building an informed decision making, and informed and shared decision making. So it really should be throughout, not just at the beginning, but really throughout the whole treatment. We sometimes see some rare side effects that show up, and it's really important to go back to those and discuss those throughout the treatment. But it really starts at the beginning of treatment.
Yeah, and how do you help patients understand that balance between treatment effectiveness and quality of life?
And that's a that's a great question, because it's the side effects are rarely sort of black and white. Sometimes a therapy may offer better cancer control, but at the cost of significant fatigue, neuropathy, nausea, weight loss or weight gain, or just frequent clinic visits. So the conversation really has to be what matters most to the particular patient, to the individual. Some will say, I want the most aggressive treatment possible. Others may want to um, prioritize feeling well enough to spend time with family, or just out of the hospital, really. Both are completely reasonable perspectives. So it's always kind of an ongoing conversation, and similar to what we talked about before. I mean, it's not set in stone at the beginning of treatment. They can change throughout the treatment, and my job is really to translate the medical data into real life implications, so that patients can make the decisions that align with their goals and their priorities. And at our clinic, we spend a good amount of time evaluating those priorities, which really helps shape our discussion throughout treatment.
Yeah, and I've been involved with a lot of reviewing of protocols and clinical trials, and talking about the side effect tolerance. Is one of the things that's really important to me. And so, Mark, why is side effect tolerance so different from one patient to another?
That's a great question. We ask ourselves that question most days. Um, Side effects are not experienced in vacuum. That's the main thing here. The exact same toxicity can affect two patients in completely different ways. Mild neuropathy may seem minor medically, but for someone who works more with their hands, or it can completely help change their quality of life. Fatigue may be manageable for one patient, but devastating for another patient. Maybe who's caring for a spouse or still working full time. There's also the psychological component that goes with this. Um, some patients are willing to tolerate almost anything if there's a chance for more time, um, and that's a perspective there. Others may place a um, higher value on maintaining their current quality of life, and that's why truly personalized care is not just about biomarkers and genetics. It's also about understanding the person sitting in front of you. From the clinical pharmacist perspective as well, we look at some clinical factors that may influence how well a patient may tolerate certain treatment. We look at baseline organ function, kidney and liver function, performance status, how is the patient at baseline, nutritional status, maybe prior toxicities from other treatments, existing side effects that are shared with the treatment, so existing neuropathy or cardiac history and potential drug interactions. A lot of times those are overlooked just because we're still learning about some of those drugs. And drug interactions can increase or decrease the levels of the drugs in the body, and that can affect tolerability and side effects. So two patients may have the same exact regimen, but their ability to safely tolerate it can be very different based on multiple underlying factors.
Yeah, and I love that in the first episode in this series, I spoke with Dr. Eric Singy, and he talked about the partnership between the patient and the clinicians, and I think that's really important. So I'd love to bring our patient guest into this conversation. So, Nancee, how much did side effects influence your treatment decisions?
You know, that is such an interesting question because I am in a little bit of a unique situation in that when I was very first diagnosed, there was only one drug that was available for my specific disease. And there was only one dosage because it was one pill. So there weren't really options as far as would I have picked a different therapy? Would I have done something different based on the side effects? Well, going forward, that was different. I had other options when I had progression. But I would say at that point, when I did progress, the side effects had a huge impact on my decisions. For me, at least as of now, it's easy for me to say this. My focus is on quality of life more than anything. I think and I think everybody, as Mark said, is different in, what their preferences are about extending their life as long as they can versus quality of life. And sometimes you don't have to always trade that off. I was talking recently actually to Dr. Kamich, who we discussed earlier, and he was saying, really you should focus as much as you can with your practitioner, your oncologist on having the very best quality of life that you can ask for that. You can ask for the very best quality of life possible. And then you have to figure out how that looks and if that's possible and what the possibilities are with the medications and therapies available to you. So I've been pretty good with the side effects, but what I do know, to Mark's point, is every patient is different. I didn't know that before I was a cancer patient. All of us taking the same medication, it's wildly different to the point of being completely debilitating when someone is bedridden with the same dose of medication and I was still walking. long distances, or other people were still running and doing, working full time. And I don't think you know that until you make the choice. And even with the other associated things like your other health issues, and nutrition and et cetera. It's just a weird thing how body chemistry is. And what I would say is it's really important to be really honest with your oncologist about those things. Like I wasn't. I was very much like, I'm fine. I don't want to complain. And that wasn't always to my own best. And I've learned since then. But I think you have to really have those conversations and talk about options to improve the side effects.
Yeah, it's interesting. I think we talk about, clinicians being honest with patients, but it's also bidirectional. It's patients being honest with their clinicians too, right? About what they're experiencing,
Yeah.
right?
Yeah. My husband would be like, you need to tell him your legs hurt, and I don't think I'm alone in that. And I think the advice is, if you have a care partner and you feel comfortable with it, let them contribute to the conversation too, because they might see things like even cognitive effects. If some of the medications have, which I know that they do, have cognitive side effects, they may even observe something you don't observe. And they can contribute and really try to focus on helping you continuously improve both the effectiveness of the medication and the longevity of your life, but also your quality of life.
So, Nancy, were there side effects that, in your experience, that became more impactful to your daily life than you expected?
Yeah, when I started taking the medication that I'm on now, which is alectinib, it was relatively new. It wasn't even available when I was first diagnosed. And so all the current side effects weren't listed the way that they are now. And so I didn't even expect some. For me, have had really terrible neuropathy. And that was surprising because I thought, well, people get that with chemotherapy, IV chemo. They get it when you have diabetes and other things. I didn't expect it to be as bad as it has been for me. Um, and yeah. So that was really mine. I know other people who have had other fatigue, terrible fatigue. But that one was surprising for me. It impacted me because I'm a really active person. I like to walk. And although that makes it feel better, it also makes it harder to get going, and so, yeah, I do think, that's a minor one compared to one that a lot of people have, but it became major for me.
You touched on it, Nancy, earlier about the role of the caregiver, and I would just love to hear your perspective on that. For Nancy, for your caregivers, um, what role do they play in helping you with some of these decisions that you made?
My husband has been with the primary. I mean, I have adult sons who are awesome, and I honestly kind of try to shield. I know they're adults, but I sort of shield them from most of this stuff. But my husband has been there, and he has been really vocal. Like, you've got to say something, or you got to talk to him, or talk to the nurse. Who has been really helpful to me, and I don't know if every office is the same, but there is always a fellow at UC Health where I go, and they're typically, obviously newer and younger, and they seem very anxious to solve these problems. And I've had the really great, I mean, my oncologist is amazing, but the fellows have been so helpful at coming up with creative solutions, and talking about different things that you can do. And Paul, my husband, was always there to say, yeah, let's do that. Let's try that. And he would encourage it when we got home, make sure you try the things they suggested, acupuncture, other things. The other thing, and I think, Mark, you were touching on it when you talked about fatigue, is I think people underestimate the mental toll that this can take. Just, whether people are prone or inclined toward depression or other mental, just the fatigue of dealing with all this. I think that's also where both your practitioner, but also your care partner, to your question, Dave, can really help and say, hey, I see that you don't seem like you're okay right now. Let's go for a walk, or let's talk to the doctor about it. And for me, in the end, we resulted in a lowering my dose. And that did help. And I know that, to Mark's earlier point about preferences, about concern about, how long will that impact how long the medication will work. I just sort of weighed that and listened to the expert, and I did lower it, and it's been better. So I think those are interesting, and Paul, my care partner, was a huge help in that.
Yeah. And, one of the things that I think about is, um, you've talked about it, Nancee, about how, let's say, well, how are you feeling? Just, I'm fine, right? You don't want to bother people. You
Yeah.
don't want to, right? So
Oh yeah, I'm the
did,
worst at that.
yeah, I am too. But
I could see that.
so did you personally ever hesitate to report side effects because you might be worried your treatment might change or stop? And maybe not just for you in particular, but other patients, I think, if you can
I
talk
think
to them.
that happens all the time,
Yeah.
all the time. I think they're worried, especially depending where you are on the therapy path. Like if there's not another TKI to try, they're thinking, oh no, if I express too much discomfort or too many problems, they're going to take me off TKI altogether, and I'm going to progress, or they're going to put me on IV chemo right away when I'm not ready, or go from one TKI that has a certain kind of side effect profile to a different TKI, which has a profile maybe you're more concerned about. So I did not have that issue myself, but that is really, really well known, and I think a lot of people struggle with that. And instead of, I think it's either have the conversation with the pharmacist or your own oncologist, or go to a specialist in your own specific kind of cancer. There are different specialists for each different kind of thoracic cancer, to say, what are my options? And for me, like I said, dose reduction was an option, or go to see a palliative doctor. Like sometimes I think people aren't aware of all the different things they can do before they have to, stop using a specific medication.
That's such an important, such an important point, Nancee, because I've recently, you know, come to understand more about like dose reduction and how it can be done and not affect the efficacy of the medicine. And so, Mike, I'm going to bring you into this, Mark, because I think a major part of decision making is helping patients feel empowered to speak up. So how can patients feel more comfortable asking for supportive care or dose adjustments or treatment changes when necessary?
Yeah, that's a great question. I mean, a big part of it is creating that environment, that space where patients can share this and understand that reporting side effects is not equivalent to failing treatment. I often don't like, and this is a scientific term, it's dose reduction. I like to use the word dose adjustment. I feel like that term
That's a good point.
can really help kind of convey the picture that just because we are lowering the dose doesn't mean that we failed treatment and that the medication is no longer working. In fact, it's key for effective treatment to stay on treatment for a longer period of time. So this allows for that. One thing I try to do is ask very practical questions, the general ones. I like to ask, instead of just how are you feeling, are you still able to perform your daily functions and all of this stuff? So that's key. But it's sometimes we even bring in some of the data that there's evidence for the efficacy of lower doses, and that these doses are FDA approved. For a reason, because they were studied, they showed effectiveness, and that's key. So I think there are some strategies here, but often creating that space in the beginning to allow for patients to share these can help during treatment, later in treatment as well.
Yeah. And Mark, I was so happy to have you come on the show with me because I have a fondness for pharmacists. My father-in-law was a pharmacist, and the active role that you play in, communicating with patients is really, really unique. And I didn't ever understand the role that pharmacists can play. So when a patient asks, like, how is this treatment going to affect my day-to-day life? Like, how do you guide that conversation?
And that's a very common question. We really have to start with what is day-to-day life for you. what is, because we have to have some realistic expectations going into treatment. So I try to let that guide our discussion. So, it's, what are your priorities, and is it important is exercise a big part of your life? Is travel, care for family members? I think those things are important to kind of guide our discussion, and then we talk about some of the side effects and how it can impact that. um, what if it's a lot of times fatigue is a big part of it. So we talk about which day, which time in the cycle, if it's IV, infusion, is that it's going to be the worst fatigue. Sometimes into treatment, where is the fatigue going to be the worst? What time? And a lot of times it varies from one patient to the next. But essentially, there's a sort of a general trend there too. But it's important to prioritize those based on the patient's day-to-day life and priorities. And a lot of patients continue normal activities during treatment, and some need some adjustments. So that's completely fine to bring that up and to explain that in the beginning. And it just depends on the regimen. It depends on baseline health. So my role as a pharmacist is to sort of ask some of those, go through these logistics, how it can impact quality of life, supportive medications, managing nausea, managing fatigue proactively, infection precautions, the medication schedules, all these things. And that sort of adds to the continuity of shared decision making, because this will probably change throughout treatment. Maybe later in treatment, priorities are different. Your day-to-day life is different, so we might have to readjust and look. And we have a lot of treatment options nowadays. We're so blessed to have those. So we have room to consider other treatments, but the impact on daily life is a essential component of shared decision making throughout.
Well, well, I think the theme I'm hearing, from both of you is really important. And a lot of the oncologists, I know a lot of oncologists because I've had many of them on my podcast, talk about seeing the whole patient and not just the time that they're with you as a clinician, but they have lives, that they live. And so making sure that you understand and are empathetic to each patient's life and what's important to them, I think is really important. So, Nancee, was there anything that helped you feel comfortable speaking openly about with your care team about side effects?
I think for me, it was my specific oncologist because he was very warm, asked a lot of questions, had a lot of humor, which is sort of how I like to communicate. So that's not fair for me to say because not everybody has that, right? Not everybody has that same experience or that same opportunity. So I think if you don't have that, maybe you can start to be more comfortable if you include your partner or if you write a list before you go in. So you're not, going in and trying to just think off the top of your head. Or frankly, if you go get a second opinion or go to a palliative care specialist, I think there are just a lot of different options to start to be more comfortable. Excuse me, if your specific oncologist doesn't feel like that place for you. And that isn't even a judgment on the oncologist. Everybody's different and everybody's different about who they're comfortable with, as well. But for me, I think it was my specific experience. I was very lucky.
Yeah, yeah, and I love the fact that and I know your oncologist actually, Dr. Camage. He's brilliant, and I know that he has that approach of seeing the entire patient and not just the time
Yeah.
that he's that you're in a face to face with him. Uh, was there anything that you and I know you had a good relationship with your oncologist, but looking back, was there anything that you wish clinicians had asked you earlier about side effects or daily life?
Yeah, I mean, I think it would have been nice, and I think that they do that more now, just in general. To what Mark said, is ask about what are your priorities. Like, what is important to you to still be able to do? And I think where they didn't used to ask that when I first switched medications was they weren't as aware of all disappeared. I have sun on my face. I'm hoping you could fix some of the stuff, Dave. I think that what happened is they've become more aware of the side effects, so they have started to be better able to address your day-to-day life. So I do wish that people in general, not my oncologist, but practitioners in general, did what Mark said and say, you know what, where are your priorities? Is it to be able to play with your children? Is it to be able to continue your job? And I think those are different because the side effects, if you have to sit at your desk job, that some side effects won't impact you as much as if you're a teacher at a preschool, And so I do think that would have helped me and others. Not really, it wouldn't have necessarily changed my path, but I think it would have changed the way I thought about side effects and managing them and the conversation. I also think, and I'd be interested in Mark's point of view, I think there's a cumulative effect of these TKIs at least over time. Like I don't know if we knew that because they were brand new when I started, but now I'm like, okay, several years later, you're seeing other things. And of course, some are going to be related to age and having cancer for a while, but I think more of them are related to being on that type of medication for years, which I don't, I think will be an interesting study somewhere down the line. Like, what are the effects that now that we live so much longer than we used to, what are these medications doing to our quality of life over time?
Yeah.
That's a really good point. Mark, you want to chime in on that?
Yeah, that is, as we learn more and as there are more studies out there, we're learning that is exactly true. I mean, there's a cumulative effect of the same drug. There might be several drugs from the same class where we see the side effect is the risk of a certain side effect is higher because that risk was also from the first line of treatment. So those are that is exactly what we're learning with different studies and publications that are coming out showing us that, let's say, the risk of pneumonitis or like interstitial lung disease, that risk is different if it's a drug in the first line versus the same drug maybe in the second line of treatment.
Oh, that's interesting.
Knowing these is key, and I think it gives it gives us it gives the patients a sense of control to know what to expect and what to look for, and that's key during treatment and when in cancer.
Yeah. And so, Nancee, I think you and I are, we're active patient advocates, and I think it's not for everybody. Like a lot of patients, don't take an active role that maybe you and I would take. So
Yeah.
I'd love to ask you, like, what advice would you give to patients about advocating for themselves during treatment decisions?
I think you have to really focus on the fact that although you have cancer, you are still yourself. You're still the same person you were before, and you still have a life to live. And you really want to have the very best experience, whatever that looks like. And truly the only way to get that is to advocate and think about if you have a family or other people who are relying on you, I guess that's what I always think about is what my family would want me to do would be to make sure I have the best treatment so that I'm available to them. And to do the things that I want to do. It's very different from us being patient advocates, I guess, out in the world trying to, change the world. But I think you're trying to change your own little world by saying, how can I join a support group? Because I belong to a Facebook support group, which at the time seemed frankly kind of silly to me. And it has been a wealth of information and kind people. And you can ask questions and realize, oh, I'm not the only one with this question. 15 other people have it. They maybe have 15 different answers, but those answers can arm me with information to go back to my doctor. I haven't had to do that, but I've witnessed people going back to their oncologist with information from the support group and literally changing their treatment path because perhaps it was a community oncologist who didn't have the same experience or had never seen that side effect before. And so I think, to get as much knowledge as you can be a great advocate. You can be a more confident advocate, I would say.
Well, I think that's really great advice. And I think for people who might be shy about, like, oh, I don't want to question the doctor because he knows
Yeah.
best, right? That and Dr. Singhi actually in our first episode talked about that paternalistic, changing that paternalistic view, of just taking the, recommendation of the doctor, and he knows best and she knows best. And so I'll just do that. But, and that is important because you want to trust your clinicians, but the clinicians also have to understand that every patient is different. Right. So, um,
Yeah,
and
and
that
you're
kind
the
of,
expert on yourself, right? They're an expert on science, hopefully, depending,
right.
but you're the expert on your own self. And I think that partnership is where you get the best result.
And I love that phrase partnership. So I think that's really important. And speaking of advocacy, Nancee, I'd love to ask you about, when I first met you, I learned about a publication that you were involved with the ALK Positive organization, and I'd love to have you just give us a kind of a overview of like what that experience was like, and what it how meaningful it is to patients.
Yeah, I'm on the board of Elk Positive, which is a nonprofit, and as a result, I interact a lot with pharmaceutical patient advocates, and we work with Pfizer quite a bit. And they were developing a paper which was meant to help people who are taking lorlatinib have a publication that could speak in sort of patient terms versus in medical terms, so in layman terms. So they went and they included a lot of different, like, amazing oncologists, world-renowned thoracic oncologists, and then little patients over here was me and a couple of other patients. I am not a lorlatinib patient, which was actually part of the goal. Was the publication is written for someone who is newly prescribed lorlatinib and what to expect, and it had a lot of basis in the Crown data and the information that came out a couple of years ago. I think there's probably more to come this summer at ASCO. But the information about what the side effects are, and it has some really interesting graphs about what side effects could come, what the timing for those is, what percentage of people have those side effects, what are the different treatments, when should you call a doctor, or what are things you can do at home. And what they did with me is they just leveraged my non-scientific experience, a lot of knowledge about lung cancer, obviously, but as a patient, they really were great about taking our input and our feedback into, like, hey, this doesn't make sense, or this would be easier to read. And I was really proud of what they did. And I think Pfizer was amazing in being so patient forward. They're actually, really good about that, including patients and everything they do. And the goal of this is to be, you could take it as a patient to your doctor if your doctor didn't have it, or hopefully, oncologists will get it and be able to have the conversations about all kinds of side effect management, including dose adjustments, as Mark said, which is a big one for lorlatinib in particular. I assume you prescribe that frequently if you work in thoracic oncology. So it was really a wonderful experience. I felt lucky to be included, and it was really kind of them to take our feedback, I thought, and I was proud of the result.
That's awesome. Uh, One thing that I've learned from our discussion today, thank you both of you, is talking about dose adjustment instead of talking about dose reduction. I think that's awesome. So
Yeah.
thank you for
Thank
that.
you, Mark. I would not have said that, and I like it.
I think it's brilliant. And by the way, what I liked about the publication, and I think the reason I wanted to have you talk about it, Nancee, was because maybe a lot of patients aren't finding that publication because it's kind of a scientific thing. But what I liked about it was the customization of it. It was sort of like the personalized. It was like,
Yeah.
here's what you might expect in 3 months. Here's what you might expect in 6 months. And so it was really personalized to the patient experience. I think was really important. So that's kind of what caught my.
The same. I like that also. And they also did, like, it may start in 3 months, and for most people, it lasts 100 days, something like that. So you were thinking, okay, am I in the norm on this? And maybe this will be over in 100 days, whatever this thing is, or a lot of people who take that particular medication have really big issues with weight gain. And I think even just being prepared for that and understanding that can help people evaluate how they're going to address that before it happens, before they gain 30 pounds out of nowhere or something like that. And it's interesting from a mental perspective. We did a focus group, and out positive and talked to a lot of lorlatinib patients. There were some cognitive things that people had issues with, but primarily it really was weight gain, which kind of to me goes back to mental state, like what things are making you just feel bad about yourself even. And so I felt like that paper helped people think those things through before they happened, so you could try to mitigate the side effects.
Yeah, and it's interesting you bring up that particular side effect. That sometimes I think there's a disconnect between the clinicians and patients on what's important, and
Agreed.
weight gain is something that might be extremely important. It would be to me.
I feel the exact same.
Right. So before we wrap up, I'd love to ask each of you one final question. I'll start with you, Mark. Like, what is one message that you hope patients remember when thinking about side effects and shared or informed decision making?
I would say learn about the side effects. Do not hesitate to report them. And dose reduction is not treatment failure. There are always options. A lot of the side effects that we talk about are generally treatable for the most part. So there's always something to be done, but the conversation starts with when we know about those. That's what I would say.
Awesome. And Nancee?
Would echo everything Mark said. Just adding that, be your own advocate. The treatment, the side effects are not your destiny necessarily. And you can try to treat them, but they can't help you if you don't tell people that you're having them and try new things.
Oh, that's awesome. That's great advice. I think today's conversation is a reminder that side effects are not just the clinical details, but they're lived experiences that affect daily life and emotional well-being, independence, treatment decisions, and shared informed decision-making means, making space for what we've talked about today, these honest conversations, not only about treatment effectiveness, but also what matters most to each individual person that's receiving the care. So I am so grateful and honored to have you both on my show. And I want to thank you, Mark and Nancee, for sharing your perspective and your experiences. And thank our listeners for joining us for this important discussion. And again, Mark and Nancee, thank you so much. I can't tell you how much I appreciate your perspectives and being on the show today with me.
Yeah, thank you for having us, Dave.
Thank you so much, Dave.
Yeah, and thank you.
It's a pleasure to meet you, Mark.
Yeah, pleasure to meet you too, Nancee. And thank you for creating this space where we can discuss these important points.
Absolutely.
Thank you.
That's important.
Awesome. Thank you.